new study found that consuming more than 2 liters of diet soda per week can increase the risk of an irregular heartbeat. The study was published in the journal Circulation. It examined more than 200,000 people and found those who drank roughly 6 cans of cola a week were 20% more likely to develop the condition atrial fibrillation, also known as AFib. During atrial fibrillation, the heart's upper chambers, called the atria, beat chaotically and irregularly. That definition coming from the Mayo Clinic. I want to bring in Dr. David Majure. He joins us now. He's a cardiologist at NewYork-Presbyterian Weill Cornell Medical Center. Doctor, thanks so much for joining us. I want to ask, first off, this study looked at more than just diet soda. What else did we learn from it?
Yeah, thank you, Michael. Well, it really looked at 3 different things. It looked at consumption of sugary beverages, artificially sweetened beverages, and pure juice. And basically what they were doing is following a large group of patients, about 200,000 patients in the UK, and seeing about their consumption patterns, how much different types of foods they ate, and what sort of drinks they had. They looked at these things over about 5 years and then followed them for 10 years. And they showed, not surprising, we've known this, that sugary beverages are associated with bad cardiovascular things. And in this case, they showed a 10% increased risk of atrial fibrillation with sugary beverages. But what was surprising was they also showed a 20% increase in the risk of atrial fibrillation with artificially sweetened beverages. And also, interestingly, if you drank less than 1 liter of pure juice, there was a slight reduction in the risk of atrial fibrillation.
Interesting. You know what? I think some people, when they hear the word diet, they assume healthy. Yeah. What does diet soda actually do to the body?
Yeah, that's a really good question. You have to take it in the context that the diet drinks were really developed or marketed to help us get rid of the sugar that we were consuming, which we know is very bad. Sugary drinks are associated with obesity, diabetes, a host of cardiovascular problems, and people would like to avoid these. And the artificially sweetened drinks serve as a substitute for this. What we don't know, however, are what the full health risks or benefits of these artificial sweeteners are. Things like saccharin, sucralose, or aspartame, which is most commonly found in the soda drinks that we have.
We've been talking a lot about atrial fibrillation. Are there symptoms that people should be watching out for?
Well, in terms of atrial fibrillation, which is a very common problem, sometimes people don't feel it at all. Sometimes they have palpitations. Sometimes they can feel short of breath. In the long run, very concerningly, can lead to heart failure or even earlier death. Most people, or the vast majority of people that develop atrial fibrillation, they need to be on a blood thinner to prevent stroke, which is obviously a very feared complication of atrial fibrillation.
Doctor, there's a lot of diet soda lovers out there. Are there any healthy alternatives you can recommend?
Well, the first thing I would really say here is that this is an association. This is not to say that the artificial sweeteners caused atrial fibrillation, but there's something there and something that we need to learn more about. My real take-home in general is that I push everybody to drink and eat natural products, natural foods, and really avoiding anything artificial, really thinking about this from a holistic perspective. How can I improve my overall health by taking in real food and not artificial things?
Some great advice, Dr. David Majure. Thanks so much for joining us.
Oh, you're welcome.